In the majority of cases, 70% of cases, the symptoms go away within 10 days or so. In the kind of 30%, the remaining 30%, the unfortunate 30%, they end up with what's called persistent concussion symptoms. It used to be called post-concussion syndrome. So now it's called persistent concussion symptoms, same acronym, PCS. So we have this metabolic dysfunction that happens initially. If you still have symptoms beyond a month, you're called PCS, persistent concussion symptoms. Well, why would that happen? If the mitochondria and all that stuff has recovered within that period of time, why would we have this? Well, there's 5 main kind of reasons that this could be. Number 1 is dysregulation of the autonomic nervous system. So the autonomic nervous system is fight or flight, right, which is your sympathetic side. And then it's your rest and digest. This also controls your heart rate variability, but also the blood pressure and the response to oxygen and CO2 levels in the brain. So it's what regulates blood flow throughout the brain. We know that this system is impaired after concussion. So if you have ongoing impairment of the autonomic nervous system, things like increasing your cognitive load, increasing physical activity, if you start to exercise, may bring on your symptoms. And that's actually the test for this. We do an exercise test to try and figure out what's your threshold. If you get symptoms and at what point you get symptoms, that shows dysregulation of the autonomic nervous system. Number 2 is inflammation. So after concussion, you're going to get inflammation of the neurons and also the supporting structure in the brain and the nervous system. So neuroinflammation, you get activation of these glial cells, which are support cells in the brain, and they're kind of the macrophages of the brain, if you will. There's also dysregulation of the hormones. So the pituitary gland, just based on where it sits, can get like kind of a cross shearing as well. Also blood flow with dysregulation, and also, stress, lack of sleep, financial things, all these things put pressure on the hormone system. And we've seen reductions in growth hormone and all sorts of other pituitary based hormones after concussion. And that can bring on similar symptoms as concussion. Number 3 is visual and vestibular dysfunction. So obviously, we know what the vestibular system and the visual system does. People that have dizziness or trouble with crowds or navigating their environment may have some visual vestibular issues. That requires rehab. So again, this is why our professions should be the ones kind of leading this charge. There's nothing really that a neurologist can do beyond ruling out some of the red flags that may be going on. But beyond that, the treatment is more diet, exercise, rehabilitation, and also education and kind of following the right protocols. Number 4 is cervical spine dysfunction. So with concussion, you also get a whiplash. So concussion, I mentioned before, the forces are 70 to 120 Gs of acceleration. Whiplash or mild cervical strain injury only takes 4.5 Gs. So that means that anytime there's any type of concussion, there's always going to be a whiplash. And the literature has shown this, that 100% of the time there's always an overlap. The symptoms of whiplash and the symptoms of concussion are identical. You cannot tell them apart. So somebody who's had a concussion and a whiplash, they think they've had a concussion. They haven't really considered the whiplash portion. They're walking around in their life wondering why they can't navigate their environment and why they can't think properly. Meanwhile, all the same symptoms come from neck dysfunction. The neck influences your visual function. The neck influences your vestibular function. The neck is associated with light sensitivity and sound sensitivity and tinnitus and ringing in the ears and cognitive function. This is all based on neck stuff, which is why chiropractors, osteopaths, physiotherapists should be kind of leading the charge in this area. So that's number 4. Number 5 is the psychological end of things, right? The unknown, anxiety, depression, post-traumatic stress, all of these things overlap directly with concussion as well.